asɛm wei hu dahuro na yɛn nso yɛfa mu suahunu bi na yɛde ayɛ den abɔ yɛn nipadua no ho ban, because you and I know say ɛyɛ akyɛdeɛ a Onyankopɔn de agya yɛn a ɛsaa kae sɛ aduane bi a ɛbɛfa wo wedeɛ mu biara na ɛfa w'anum ansa na ayɛ den akɔ wedeɛ mu. You could be introducing all kinds of bacteria in your system and also ebetumi cause problems ɛwɔ wo system no mu. Mede ma no asi sɛ questions bi wɔ hɔ me try sɛ me answer. Contributions bi so wɔ hɔ a contributions so ɛyɛ allowed. Ɛna ebinom nso wɔ experiences bi a wɔbɛtumi de aboa na yɛde abɔ saa dwumadie nyinaa ho tɔfa nso a mutumi de ba na yɛde aboa dwumadie na yɛde ne nyinaa asi. Like Sister Judith Kaya no, me wɔ masters in dental hygiene, me specialize in dental public health, me wɔ doctorate in healthcare administration, me entrepreneur because I've had a independent dental hygiene clinic. I had 6 different dentists working in the clinic. And now I'm also a professor at Concord Career College. I am a dental hygiene professor in Dallas, Texas. Intino, so mrepanso be mu biem na se nyamra. The next you go into dental insurances, the right insurance to choose, what you should expect from the insurance. If you choose HMO, if you choose PPO, those all has clauses be a woman. Having that clause, and only be determine the type of treatment providers allow to have for you or to do on you. So, ntino ni nyina no mrepabe mu ayebetimi ababa mu amehu na you choose the right insurances. Send be ya and also no be den ebeboa, because dentistry in North America is very expensive. And then we talk about demographics. APR ahano angel dollars uni betumi spending on your teeth. Well, you betumi are converted into cities. Ghana see dentistry so no epeja amanfo ehunhu say e DS omo yeden omo ebo omo se ho ban a. In Ghana, you will find a nice dentist. I will bet me I have colleagues here across Moko, Ghana, Ekoye dental hygiene clinics, Better dentistry. Me will friend be a menene chadi waha Oko, Ghana, Eko, or Kwan no Kwana catcher me say Kumasi pro must be another one Oko, Bako Airport Hills one mona, Kumasi so maybe. So I know say Ghana no. So Wahano Dallas ne muntumi a ko Ghana so a wo hyehyɛ wo mre no ne time na obetumi akɔ na omayeden aboa. Intino, now is questions and answer contributions, and if you have any experiences obetumi adiaba na yɛdini nyina aka dwumadie ho ne abɔ ho tofa. Medamu nyina se atiefo na minhyira so mayenda. Amen.
Amen. Amen. Dr. Yedawasipe ye. Abusanfo said the wakano. So question Oma wonsaswa na ubetimi aka na before so bekano ma yehu baby a wokase free any woodin said the beya ebeboaye opani Derek Champon mpacho ubetimi de wodi na ba wokase free he.
Yo, awo medase mekase free New York. So, ngamishira upa yati wonkana ache. Midimidi said manu mo abaye no. Anyway, my question is nim say me share enkan ye de by say will be an 32. But at times dentists mo be no etrese say ya na your wisdom teeth was a de no mututu free wansa. Na say here de na nyame ma 32. Ena me second ye wo mo frame bi ho no mo a esen 32 no, but if this esen of asio se de na afifiri ho eno so se wo baby na bibisa advice be na obetimi de ama parents me da ase.
Dr. Mpacha obe ansa no one by one and apesa omunyi na nipa miensa mbra ansa na wa ansa.
On say a refrain no me enye no one by one.
Pacha yo.
Se mre wo hon ko ade a.
Pacha emre wo ho.
Se ne be ya me remfi. Ntino wisdom teeth na wo kano. Ansa me din for new way atoso no. Se ye twa panoramic x-ray we ya eno no ma ye hu se ebia wisdom teeth no impacted, right? Na no ne saying yeah, a Christopher the GD say nyame boy, but onu nyame so I don't want to use but opanyi bi na kan say o din komo na o ka say na say o kan bata de die chire nyina ya na nyensempa. But nyame boy no yes, on my 32 teeth. Na die nti na ka say a dentist no be ka chiro say koyiyi 4 out of that 32 no. Sometimes it is believed say evolution we evolved and your jaw now it has become smaller than say tete no mo ye giants akese no wo de enemrem kura wo hu obi a wo ye tintin gram a ya no more bigger jaw. So the evolution is telling us say your jaw no became smaller and to be hu no sa esen 32 ni nyina no entumi nko onua no etikonkura nim. So entino ayesa na make us a term is impacted. Afena entumi nyina ho te se de we ejirigina ho sei no na bia eda ho sei. So afeno ayesa na ye wo ya o hwa ne nani eden echirinsuo etobu na eda ho sei instead of saying ke be gina ho straight sei no na bia akoda ho sei, right? Entino na put pressure ewo osino eden udodo musino wo hwa na ye wo ya obi wo kro wonya lock jaw untumi mie nanum niye. So we yini nyina free hwa with this type of x-ray no court ni twa wo x-ray we ya ebe kire wo osino baby bia deda na oral surgeon na ka kire say yenyi sa for we na no any problem na e so ma untumi enye yi obi so obetumi aka say well say ebia enhame a I always say on say osene how but the professionals knew who said there's a potential say be a behawa at times the crown say osene koda ebia horizontal na kakra bi pie wonu mu a sene ebeya enam no expose esene kakra ni ntino aduane tumi kwahyehyɛ saa area ho nso a untumi mbrashe ho properly afena decay start air form me ho na wanhwe ni ya wo simba akwa esenka utu no na a colleague says utu mienu na eden efri ho. I've seen this so many times. I was trained by an oral surgeon in New York in the Bronx years before I entered dental hygiene. And he just said, I've seen so many cases with him. Omoba, the best age in this cranial 16 the roots no sa nyoma wo way no the root of your teeth. Enyan develop all the way no mo yi send be cause complications be because nipa eti wo ho sa there's some nerves be yes no root of it no I supply nutrients so vitamin C and americano supply some calcium any my teeth no yeden strong it is a nerve no so root no kodaso the root of the teeth no kodaso na say omo peso mutu no ma hwe ni ye. That's why we have all kinds of x-rays, CT x-rays in this animal. No man line there that one to make sure say so yankee teeth in the outer and could jerk sa nerve to cause permanent numbness. Utikon krani mana wanim u face it in here say x-rays we no you take it then it mean who say wisdom teeth se beboa wa emwa nso ani aiden yayi afri ho. Wo se enkrani bi wo ho nso a eye omutumi nya si bebre wo manum extra teeth no your specialist be a orthodontist or no braces doctor, right? Almost straightening teeth, sometimes when we be free, no my then I make sure so be straightening back to alignment. Into no so no or more home a draw as a crano. So we be brave, see be brave when a numua, which me the call no almost straightening sa teeth, nest of mupe so we be so free more, on bit me then a be a free. Edda Derek, I'm hoping say metumi answer the question no ama.
Thank you so much.
You're welcome.
Okay. Dodi hoye Elder Daniel Edusei Poku. Mpacho kasa free he.
Yo, Mr. For make us free Mississippi. Me question no aye dear drew an as a paste the tree yes and himself fluoride a woman and my was senior white. But dog a bedroom baby be or what to paste fluoride womb so tree was still na yellow and I say the color no s the intia. The tosum ye no abofra wanya be 8 years. Ye tu ne sina molas na ebesa ba na se ye tu ninti no entimi ma se bia bibi ka molas na utu a ebetimi asan ba ono a 8 with our say.
Yo, Panini, a very good question, Pan or Busano. Now, yes, and clarify something here with fluoride. Once a fluoride, no, it's not for teeth whitening. Fluoride no, is to strengthen, repair, and protect the teeth and the bone of your teeth. Fluoride is not for tooth whitening or teeth whitening. Teeth whitening or toothpaste no be what it tells you on the toothpaste no say this is for teeth whitening. Those teeth whitening toothpaste also will have fluoride in it. So it's a wood you choose with fluoride toothpaste. Let's say toothpaste that states say whitening toothpaste then you need to get toothpaste that it says teeth whitening toothpaste. It be to say optic white. I'm not promoting them, but I use it. It helps, right? Open so I will call in office teeth whitening amount. Those are different toothpaste and then different procedures. So fluoride is to strengthen, protect, repair your white portion of your teeth, enamel, so on. 8 years old, right? You mentioned says here 2 ne se dodo no mu te se bia molars na. Provider says baby they are the crow mu to no. A baby teeth dia my problem is empanifo invite me bia ye be hwe ye mabunu nso no omo dental eye ne ehu. Say a provider says a baby teeth dia. Yes, you even take x-rays and you see say there's a permanent teeth right underneath it. So now on my den eno etua na foforo na ayeden FEB ayeden aba. Say a premature loss to say bia kaka bedam no more two na a permanent tooth woni dodo mu dia eno no the oral surgeons no two omutumi add bone graft to prepare that area for implants. Because a permanent tooth FEB maybe the bone graft the bone graft no ma akata as months and maybe years go by no obetumi aba back na the implant ama akora no. Opani, I'm hoping say my answer or question all right.
Yeah, CP. Thank you.
Okay. The next person here, Eradi Ayebi. Mami Pacho kasa free here.
Yo, that's Pacho de kitwebo akolabi. Yeah. Well, me Pacho me kasa free California. Northern California. Me Pacho medin de Mercy Usu. Me doctor yada CP o nyankopon won sha no nya okese. Sister Judith so yada sepa. Pacho masam anyina na say person mu bisa say how often was say equal yetimi dentist. Na afi so say ebi atokro bi da osinemu na enyanyewe ya. Na eno so sen ebeye. Ena ketrema no me no ya na ukas ho asem say ya na yira ewo mu a bi achade bi abe 1 year na bibisa na asade ketua bi na besi me ketrema so enti ya na ya se ne ukas etwedwa no ketua bi nso ya eba ne saa de na ebetumi aye amanako nti esen no atokro dem no sen na ebesi a nim se wo se ekọ dentist de na se enyanye wo ya obetumi atwen kakra se na nse bi me ba bi se obi na simbo tokro na wo se okọ hospital oye nurse oba omo ho no omo ye no anya infection nti ma nipa no ofri mo because of onese no if you na asa abomi hu kakra nti me pese me busa bibisa say send ibisa na how often so na was a dentist me da say me nim say masem no mu ada ho a
at the hop papa and a very good contribution on the abano on say and pray bebre no eya yen connected our oral health with our total health and now what kind say patient bako end up dying from tooth decay kaka etumikun so now the first question was say impressing na say your dental office and I make her say so we call every 6 months and no the first exams are your x-rays any measurements which is the probing and I was saying say I said what are my numbers so one tis or more check your numbers which is the probing busa a part of the assessment as a amount and no be determine how often as or then for cleanings no say a healthy cleaning every 6 months say a deep cleaning if you probe a measure who said bone loss severe bone loss like I mentioned say numbers need hit 4 and 5 so now then we would tell you say do a deep cleaning after that deep cleaning we will bring you back for re-evaluation 6 weeks after 6 weeks then you go to maybe 3 months or 4 months cleanings which we call periodontal maintenance so our maintenance is to maintain the bone at the level ehi akodru send and continue deteriorating because the bone being foundation of your teeth so we lose bone pet or sending in a coming out so that's the first answering to the first question so tokro da was simua and train on se na make kire mu say o se no nyankopon boy there's some nerves bia eden ewo o se no ase si ehwe x-ray we ya sa nerves so one hwe ni yi na sa entini na ewo o se no ase sei no se tokro na edam infection wo didi enchene asi kire hot cold citric food sugar food komu ne didi ko ne se ekoto entini ni mu a eno na cause infection etumi ma wo se na chi wo na okon lymph nodes no ayeden ayi aba very well pronounced eno na friends atwedwa no enti en twen emma enka se enye den enidin komu ma wonten kantino o twen amasa de no ato eno ena obi twen ya wo kasa okowu wo hospital no because enipa ye wo ho no nyame boy nse sa yedidifa adiem tubes any sa nerves ya make us nam yesiasi no eno na and nurture waseno with calcium vitamin C it is our nerves no sa infection ni kotamu a na infection in our bloodstream no na amasa adwa na ne yi no atumi ayeden atwon enti no ehọ na wokọ omutumi ema antibiotics to clear it off and then also they will do something ebiasa tomwa koto as atontini mu a instead of so mbetu sino na ma osino onumu obu ogumu no samfoni a mo hwe no wahai ye friend root canal omayi usini mu ntini ni nyina onse ha no entini wom onse hwe white eyi edamu ya artificial omayi mu ntini ni nyina ntino esinwe no they save the tooth integrity structure send ye beya wani mu nyeden emumum because ye tooth sina no mpe wo ho nyina so behi until they do a root canal no the crown eden ahye so sa procedure we no ne bo den no ho So make sure, say, you don't lead yourself into these type of procedures. Ne boy den papa to obi ho obe say na metua de tu efiri manum. Eno so na make na tumi ma osin den ebugum. Enti en twen ema yaw ema osin ase ansa na why say wo. If let's say baby I would you far away from any dental office, a rural area where you can't get access to a dental ear. You want a fear and you may be a cloves. Say ya on a bar, ness a woman, ne a how pa, or close, a banks I seen one. A boama and name or senase. Send a beya, a bit to me, ama pain na form kakra. But still no, ko ne kohwe achiri akwan na eno ebeboa. The other question here was it techrema no. Eno no na wo kase I think say you lost me there a little bit. Was it what techrema no say so betimi remind me a
Siso, bibi besiso.
Aha, na wo say bibi besiso. That's it. Aha, na no say bibi besi wo techrema so a that means say wono wohwe utechirema so no epai very good say wo monitor say bibi besi so a wo ba intraoral exams no ye be measure the length diameter of this year sisu no na ye ebia dentist no be biopsy ehu ade kro sometimes no Sanyama we nyina no ka hu say benign meaning say enye cancer until say get to cancerous. So ubetimi scrape it off by getting some tongue scrapers ni bia na the bristles of your toothbrush no to me the brushing it off. Inti esi twitwie no enye say wutwitwi osi animu ne akire ne yayin nko a esa wo sa brush otachire ma ne so. Se sa de we no esa wo kɔ na besi so a wokohu adekro. On say certain deficiencies be to say vitamins bi no. Se bibi besi wo nipadua ne mu a sometimes no nyame aboyen say o techrema no tumi eyi saa nsenkyerene bi e de kyerɛw say ene ekɔ ewo widie no omu bekɔ okɔ medical doctor ho a we will send you back now medical doctor na hu say yenye blood work ana yenye biopsy no omu aye ehu ekyire akwan enti ni nyina ebesi say eyesa wokɔ every 6 months na wokɔ check sa nyoma we nyinara se ne be ya eba wafamu a at the early stage no ombetimi aso ano amount. I'm hoping say my answer the question amount.
Mpacha medasi pio nyankopon nyokese na mpacha last one we dem pamocho mpancheme mebacho na wo kan paste no president no aye di twetwe ese no o mse president e obi su di edi mebacho na ayi mpasa meka ebidi se na akasa menyo commercial ma obi ne ya abidi ewo mu no 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 mebacho ya na medasi we my last
on said jabidie eye yenkrom ade bi a ye nananom di gya yen na it worked for them maybe the teeth whitening but bibini eja yen ne na ye no bibimam no ne abefa abrofo no de na the same thing on my package amaye no na ye think say no na eye den eye papa and some stores so kwa ya yam jabidie e de egu container mu out me do toothbrush bosso na de eden etwetwe osin e kire se de wo no bibimam no enye primitive ombehu se eboa eye but on say everything in moderation jabidie no a little bit abrasive me can abrasive I had to say anwea anwea so de so wodi twi osin back and forth cha a thin sa white portion of your teeth no enti no wo ho na se fem ye den e ba oso se ne opanyi bi busa question say teeth whitening no jabidie no utumi de twi osin e ma wunya teeth whitening efrim so na fluoride toothpaste no boa a strengthen with teeth no tijabidie no too much of it no enye it may create sensitivity amount but yes a boa ama o sen ye fite abrofo no ye concept na sisi o modi abre ya ye kwa akoye den ekoto no enti eboa good I'm hoping someone answer that question. So I'm
Okay.
Me pa cha nyankopon nhyira bebre na me nhyira. That's it.
Yeah. The next one is Openi Joseph A. Mpacho kasa free he.
Pastor Mikasa free Vermont, Wellington.
Okay, good.
Dr. Enda Wasepane and Church said there was the Atobo say now we in 1-1 at the Mayano. Yano baby, I just said line house and it's come one organization. And doc me dear Kakra, maybe Sunny say, no problem, missing. One say, me 36 years and me call, 10 is my first time. Say Ghana the na yam fa nya adwuma backroom hana me ko pie ba me ko am ko check me ne say me se na bia ya okay na problem bia ni ho enti free ho no ese makọ me kokọ me dentist ba be like be 10 years meaning and me dentist no hunu se me se no ya na ese nam na wo achire eko medodom no na atake swele enti me hu na me yam hyehye me a medical say asema doctor no kan say o say omkoye surgery nanka omo scrape free ho enti o schedule me for to say me enti me ko na ye obeye saade no ana obi sa me say me se na eye me ya nam se dabi eno se ne ma menya ade na meye no saa se gina mpese me ye ne minjai na wono a oye doctor na wo gina wo ne meye no saa de na me kasa me wo no obodi se bibi the ptosis or something or see ebi wo no the same thing na ye no but se nye me ya de a ma me nka no na menya kan pa tembia na be very sensitive nti ma mpe se me ye nti wa anye na me jae and I'm back to me primary dentist no. The free hono, as the biano schedule me every 3 months instead of 6 months. And I said, I work on a main corners. Maybe every 3 months. I say, Terry, don't have bibisa. Me go for terms normally see the man no. And me corner every 3 months. We are me quite no clinic. But what I see is say, I started will write her. Atimaya a year by say a bad name I jai and as I was started the other side low and I was really about as I die. But me call na ucha a yena Didia so edit an aquama and yamia Nikrubia woman not to Krubia so name. And Tiana sometimes it baffles my mind say I don't know what is going to happen in the future. Kind of a little bit scary. Yeah, na me be say me say me titi inti future inti ade ba ko ye ma me say o ma me ye mouth guard eso was say me say me da me ka me sinisi so pa I don't know say me struggle to breathe I don't know inti ese me pressure me sena na do bra ma da na ni na me ho so enu nti na ama ese no ebo emia na ama epese eba nam no no Timesene nam naswell, but no so and yeah, maybe me come dental now said or Kawashisha manana, but every day I know a check x-ray, no a check in Timmy Kono besides me whom be me see Debbie. No, it's okay, Bibi also okay. And Timmy me question I say what is going to happen in the future? Thank you.
A very good scenario, pa now dear my on say now we'll say we'll call dental office hona or muye cleanings now. My question is once I can doing my lecture and say make sure say your dentist in your cleaning. Request to say dental hygienist in your cleaning. So because all this assessment now you check it unum peno and measure a training in so next a dentist in just in the beginning stage when you say you were 36 till you became 46 10 years later. So no one share throughout the whole a dentist in there share who said they're not some of them might not be doing a thorough oral hygiene cleaning for you. So because dental hygienists, we are trained to do such. And dentists also are trained to do what is in the scope of their practice. Now in prepi, omono, because there's some bad actors in our, industry. Obepese obeye for the sake of what? Sika. Enti no obeye sa treatment ni nyina ma. Knowing say ebia wanye thorough work. Of course, obeji edi say we're a professional and he's supposed to do the right thing for you. To later on to tell you say you have periodontal disease. So that means say it was a disservice to you. Into kwa busa say dental hygienist no will be waha for them to do my cleaning. With that said, say what do call say koye deep cleaning and surgery, which is sometimes a invasive surgery and sometimes a deep cleaning, but a periodontist na beye ebia obeyi eseno enam na free ho no expose dompe na wo se no ho no we cleaning ase ni nyina owie a no attach tissue no back to the tooth. So do that stage na and na wo kana 3 months cleaning. The first time on be no krombe do be 6 weeks for reevaluation, and then it will go to 3 months cleanings. Usually you will stay at the 3 months for a long time. So it's called periodontal maintenance. It will maintain the bone at the level now. Omupese wana seni beya en deteriorate enko anything enko cause more damage to teeth by staying on top of it, and they will prevent that. So my God, they gave it to you for a purpose of say. Most of our times, the stress, echo sleep, with daily stresses, adjumai, bills, oma, oyere ukunu, efie fre, it all add to the stress level. Into koda, now we'll grind it with teeth to teeth, away. So, most of the times, come on, we are oyere betimi aka say oda ya wo bisa wo simpa ana okunu betimi aka kire oyere say because obete a very pronounced like loud noise I would grinding with teeth in it down because of your stress, right? Enti no mumma or night guard no say ne be ya wo sha wo grinding with teeth na with teeth to the plastic, so it doesn't become painful or sensitive, and I won't wake you up with swollen jaw. And nunti no mo de sa night guard ne yeden ema na sa asiachi e no so no kai se me lecture in me ka say low levels of vitamin C also can cause inflammation. So enti share a chiri akwan with your medical doctor, not just your dentist. Now omonya blood work ni finding out say, do I have low levels of vitamin C and nunti na cause inflammation of my gums ya e free ha na koha e free ha na koha no eno ebe boa to sa anamono. The next time mpanifo be ma ho kwan ye ba, we want to hear the update on it. Ebi a wo to sa anamono no be hu sa ampa na eno ane aduro ni sen anka a obedi abrobe kiwi ni sa nioma no na boa na chese wanya high levels of sa vitamin C no na aboa ma sa inflammation ni nyina yeden do away. I think say I pretty much covered most of your question. I'm hoping say my answer or questions right.
Medasi pa doctor na me sure pa medasi me advice on so be adwuma. Thank you.
Okay, that was it. The next one Rebecca Boateng. Mpacho kasa free here.
Mpacho me kasa free Philadelphia.
Okay, mpacho ma question nko.
Yeah. Mpacho Dr. Kasano oka about say you yes surgery na bibia utumi nya infection wo say why wo koye cleaning na say one cleaning we see ya it may happen. My total knee replacement, but doctor no yeah me surgery or can say anytime be a medical dentist menfa antibiotic, but it is a me doctor no obisa ewo me chart so nti obisa say mafa na nti pese me bisa doctor say how long na ese me fa say aduro no atem bia me ko cleaning.
A very good question, and it was a question in your answer na ebe boa yen nyina ana nuanom a sebi omu go through ebia hip surgery, even cardiac, heart, repair and all these other surgeries they do around the heart, and then orthopedics work, hip and knee surgeries. The anti-omoma of pre-medication, antibiotics, it just so said. Once I make I said during the lecture, and say, the mujamuno said, Osiachi or gum disease, and an advanced bone disease. Sa and namono, any mujane chimba, a free and Osiachi namono. Sa mujano, bacteria, your friend may be a bacteremia, muja bacteria woman. It means sipu around sa hips, no, any knee now are repair, no. Now, also complications. Causal inflammation around that area. No, afe na adwuma nkomaya on the ball hips and knee surgery and also no complications about one. They might have to revisit it and do away with the inflammation. And untina omoma pre-medication send be moja be chimwo osiasi bia that antibiotics will automatically usually they will tell you say 45 minutes before be dental work take his adro now protect those that area now okoye surgery send your complications be anything emma home. How long ni nyina gina o medical doctor no so when they feel say it is safe for you to be off that antibiotics now, then you do so, and yet not by yourself, because also there's a correlation there. Till they know why. Even now, our dental offices, we take blood pressures. We take your blood pressure, and if it's too high, we might tell you, say, just the cleaning, bring your blood pressure down, and then you come back and get it done. So there's a correlation between your total health and your oral health. It is pre-medication, until, say, when a medical doctor, I discuss it. Then you stop. If they tell you to continue to take it before you go for your dental cleaning, do so. I'm hoping say my answer or question all right.
Okay. Me answer that so has say. I think Mama Rebecca what's in a DNA open Derek.
Okay, Mama Fanto.
Open Derek area na Evelyn Ediatuaso.
Medase, Mami Judith. Doc, medase pa, say, me call dentist na said me can say, yes, 32. Dentist ne can, me can say, oh, na me minim se bia, me sika no pesu here, inti no pesu to be too good, man, yet, but say, what advice say, eya na etoda eboa no megini die se ama ye kona na ye nya adwene bi se ebia ye emfaso bi ani so. Dog me question na me sia bi sa ne se ye wo Ghana no ye ri ma den dompe me enchire ne ade but how me call my dentist or say ade bia eye den no me make sure say me hwe na manwe me betimi aha me. But we have Ghana no ade tina hanom no bibi te sa ade bi a den te se bi anchire ni bones no mo makwan. And a second, me say me hunu say ade what age na odura wokoye braces a emwa.
Okay, so first question say na wo ka say nompe akwasi broni ka cho say men wi don't pay. Ka hu say yen ebibrimemu no our ancestors they survived on these things. Nyankopon or boy nipa ema eduro bia ye behia wo ye redeem na care ye no or the bishe fruitum or the bishe nompem or the bishe nuane a yedim so ho enti no ka hu se ye no na ye nananom nim sa neoma we nyina nyame yi hu adi nyina kire wo mo na ono ka che ose menwe wo nompe no ene North America ha Canada saa de we ye eye nompe no matwetwa na sinasini ene omo fifififi mu marrows no edinya saa calcium na America no so wo bo nompe no mu a eboa ema o facial structure no it looks young and it looks healthy so o jawbone no so no eboa no enti no ono ebia o kasa no wo hu se the reason why I think he was saying wo hu se ebia wo se no easy to break ebia ye brittle sa calcium we no it could be say you're lacking sa calcium we no enti no wo teeth ni very easy to break into bia wo ko bodompe mu ana eden abu ana say ayeden a fracture. That's the only way I assume say obekacho say memo udompim. And besides that, it's not part of their culture. Some of them no munim sa nioma no. Enti no obekacho say emo udompim. But ono de o momo obetwitwa esinesini say ya no odidi afiri mu enya the same bone marrow no. So yen enchiri ni ye ayere no eboa ema utiti no so ye aligned. Utiti ni strong. So it's a good thing. Like I said, me start up with the oral surgeon, Bronx, New York. Many years, and I'm in an auntie. As someone papa ita can say, Africa for your teeth are very strong and it's very hard to take out. Say be a will you will sino every utikun kuranimuno. Or say Africa for one dear. Yet the more the parties will take a tubu to krana na sa. Ne sino nompen roots of the teeth na den aka enipa jaw nim so enti wontumi ntu ni nyina ya se afi na osa akwa na okọ drill ho no ku yi roots ni nyina afiri ho edi entira nompe a yewe enchiwi a ne yewe no eno no eboa straighten your teeth no emma o jaw bone so ye very wide strong o jaw bone we no emma ne strong. It's like I said, enye abrofo no bi wo ho enye omo culture. It won't tears here, but the science shows that these things in eboa ena eboa so release calcium eden ewo osino eso. Nti ehia se wo bo unompenum ehia se wo be make sure say sa calcium ne phosphorus no wo be nya bi ewo osiase se ne be ya osino be eden ebe strong. I think that that's the only question you ask, right?
No, maybe say what year na braces yeah no.
Okay. At what year na enye
effective say ehun hia say obey braces because be am sene nyina wie and yeah.
Okay, eno no gina onua no obi wo ho agire e wo ne se animu a wo nyini no nega agire no mu bai. Since we do certain age bi kra na so person will close you up. They can still move the teeth around with orthodontic work, right? We do certain age business with D 30, 40 square so person close to obetimi a close sa ejire no. Ana ebia onia so hwe say sisi ana things Ghana from the year lifestyle which is very dangerous because sa braces are who be Ghana na so yes braces be just to have it and yet a bit me just the bottom. No more just no a strong one. Omu sa metal braces ni free so sometimes no a level marks be on the tooth. Na and also no aesthetically no amana create problems amount. Of course now no, we have clear aligners, we have Invisalign, our sha. When I'm walking out to me day throughout the whole day. Na the more you wear it no na a close gaps na wo osimu na jire na wo osimu no enti age ni de age na onia no so person wo ye no at a certain age bia providers say the only factor is that the providers say wo good dental health so wo say no wo disease was here and no braces no usually no they won't put no braces on your teeth because ebema osini nyina tutu especially so periodontal disease you move sina and also no it cause bone loss. We braces no it cause bone loss. It no say osino or periodontal disease it to me it might get worse while you wear the braces. It no and no the only factor we will say it do so stage na and here so be braces. I'm hoping some answer our question now.
Thank you.
Okay, and some who I mean say yes.
Because free Europe, so be a crown someone.
Okay, but it's having patch hold on na a Joe Finian, patch over to me akoso.
Yo, me that's a pa. But that's what I mean.
Yeah, yes.
Yeah. Yeah, the doctor said, because free France. Na me follow na me dear, so na Radaric can. Me dentist. Yes, 60 years plus. But me quite dentist where. Man, it's me the ade bomisimu sounds. Me now see and committee na or 50 years so the say what 2 percent much. It's the bia catch them say na me nam so me we kase pa na me san reach we. On the catch them say me ntoaso. Me so no me tu me say me mu. Ewo me dodom say the na doctor e kan. Na no na e kaka na e ha me. Na since me nya doctor papa man tu me say me no no. Me ada Roma. E very strong. And he said na doctor e kan. Yenya itimi wika say ni mpeni to asonwe pa because na other Roma me two the same you know 60 plus me say that so very strong na ni nyina ye numpe no ene nchiwi ene nyama e di no ayewe no na me say to aso ya abeboy pa Dr. Nyamishra amen
amen. That's super for contribution.
Yeah. We pacho minim say Auntie Evelyn pacho okasa free here.
Yeah, I'm Pacho Evelyn, Mikasa Free Toronto.
Okay.
Doctor, na me pesimi busa say your toothpaste you use it's color coded. Now me say there's a difference between the kind of color that determines what is in it. Meaning say ebi wo ho a naturals, ebi so wo honom na the chemicals are frafra. That's why it's color coded. No? And Pesimi will say, is there any truth to that, Nana? And if there is, what would you suggest we do in terms of the selection of it? You know?
Very good and important question. I think one of my students asked the same question. Now, a new and information. Maybe that practice of color coding toothpaste, I'm quite sure it's been there, but we never paid attention to. Now, me busa students is na he fan usually online social media no obi betimi say say green a natural a red chemical a blue say usually what the toothpaste stands for will tell you the kind of toothpaste that it is. Say a Sensodyne toothpaste it will tell you. They even have natural toothpaste that fluoride in you. It will tell you. So color code me student in kind me catch and say research. So we went through other I even went to NIH. I said there's any truth to Saina. The thing is some manufacturers use that indication for whatever purposes that it is. Say a natural. I've never come across those colors that is explaining to me say green a natural, red a chemical, blue that question I'm still searching to get a peer review that support that type of claims. I have a student that's getting ready to graduate, and we're still going back and forth, where I even called a company and question answers on the mom, it comes off as if say they got it off from ChatGPT or social media. And with that said, mean to me, green natural, red chemical, blue until I have a peer review and a research that's backing those things from the manufacturing companies, because who knows what those colors could be, right? But I know, in search for the right toothpaste, your non-fluoride toothpaste and natural, if you're allergic to fluoride, and your fluoride toothpaste, and also a boa to strengthen the bone and the teeth around any other things that were around the teeth, and to make it, it repairs it, it strengthens it for the longevity of your teeth. But the color coded aspect in there, I think that it has something to do with the manufacturing packaging. And like I said, I'm still looking and waiting to see research that support claims. I know that it didn't answer your question. We are still looking and searching for the right, like I said, peer review, to make sure that we give the right information out there. So also any research because I know that some people will ask questions and they might have the answers there, to me the bois to me a support to this type of claims,
Actually, I don't have any research being done on it, but I'm pretty sure you agree, sir. Sometimes they can be very kind of say finicky on some of the things. I'll give you all now. Sometimes it comes out. We register there's no truth to it, but if you delve a little bit into it now, finally you see that they have some reason for doing it that way. And I'm just hoping, say, you being in the industry, not more try to find out more, and at some point, and you come up with some information and you'll be able to share with us. Medase.
Miss Medase, yes. Once we find things, research that support with peer review, backing and everything, yes, I'll be more than willing to share it. Somebody for the Mebabaka. That was it.
Yeah, that's it. So,
question.
Bacho yo, we are not media to us. So I think see a time on their call.
Yo, me das and Pacho cat in New York, as free New York.
Okay.
Me Pacho, doctor, I don't know, yes, see, if you and call me now, business and yen, and Pabia was sorry, which you was a kama. And you must before I saw the call bed, so which you treat as an wako aquada. I'm so silly, and we do baby, and that was no a yo, then a man of bassa, and we are my first question. My second question, no. Said Nancy, no, you move no, ya near shedda about my horse. Yes, me say white in Timunya white, my. Na me my friend be okoye bi ba afi oba na nanu kra wontimi mie wontimi ni di na is it advisable to do that? That's
a very good question, Wabusalo.
Thank you.
Research also my cat me who watch it.
But what I'm afraid.
Which your first Ghana phone you answer.
We are better.
Oh, say pain. Oh, say you won't crab brim, and I won't crab brim. Yes, your chichi anopa area. To a certain age, but ebia still no. Ewo hwa wunyini ana ama ebia esiyaw aba so. Esiyaw no say eye sefim ana any discomfort bia no. Sa eyaw no, it could be say yes, utwitwi at home. But Omia, are you going 6 months bia? Are you going 3 months and now 4 months bia? Because so any the type of cleanings are so there's two type of a single bang ebo. Would deal with fee now corner dental professional and a cleaning amount. Send your bay will be stay on top of it. So one of it MSCA it can lead to painful and sensitivity. If you walk a fee or brush you're not brushing it the right way. So toothbrush, bristles, a medium or harder, you're causing trauma. A heat was seno echi. Into over time, from Onkora Brim, would the hard toothbrush and a brush with teeth to the you age. A bedroom baby, not as a femun kwan and what was say, because you're not using the right bristles of toothbrush, to brush your teeth. It needs to be soft toothbrush. Send a bear, you drew certain age beer and fast a film then. Emma Osin eso say a pain so dia wo dental checkup hu say bia osin we no e deep cleaning ma ana say bia tokuru wo osin I expose wo nerve no ntina bia eden emma pain eden eba osin eso no. The other one na wo ka say I think say you are talking about veneers. obi wo hɔ o pese ne scenery te se Hollywood o sere a ni nyina ye fita te se sede o because oni di so krada na no on say the health of your teeth any good meaning say the health of a sino echi no say any good picture ya me de kire mu we ha yi na say wo sini ye fita say dien eno no wo hɔ ne moja echim dien ewo echiri na chese eno no ayese wo ye den wo bo eho ban yen eyi na se wo kɔ na se wo anya most of the time no so mo beye saa yi na ebi asia aye too bulky o ka se no nti wontimi mfansere no so wo anya the right dental on a dentist o ye saa sini bia waya amana kokwa no new graduates because of sikani brenti no aya omoye nneoma bia o ye new grad yenso ye adwuma yi no the more patients you see you get to practice so it is only an veneer naba nese wonye trained at it and okoye training na anu yai na wo koye one of the patients are all try to practice on for her ebeko kwanensa no no ebinim na first Ghana with bulky teeth Osmalia the sinin kwa na se wo kasa ne sinin kwa na ohu na ikas bebre wonanum so eno no wo be pese wo benya dentist wo betimi ye aye ne te se wo natural teeth of course once you kasa bi sisi de sekan kawa onye the same person anymore yen to me emmeke nyankopon abode but ye betimi aboa aye bibia ese kakra ebinum ye no too obvious say ade de enko wonum tie so okọ na okọ change ade no ye no foforo ma na do sa stage nim so a mimi hu a I'm thinking say you've done something wrong because our boss say ho ban a and can lead to say okọ just veneers and this permanent whitening teeth anytime bia omo beye wo se no can who say years down the line they will have to revisit that and fix it or do something on it. So let me tell because also behavior is very hard to break. While more natural one no ye more home buying. There's no way so about artificial one so the home buying. And also only na will go through this catch and so on go back no more fix it to close to a natural one teeth. And I'm hoping say my answer will question also amount.
No compassion. That may be something. Say, oh yeah, what is it advisable to go and do that? I may you call near the no white. No be who I'm saying white. No, is it advisable to do that?
I wouldn't advise it. Why? Because adia enya woya nyame abo se kama say. Na akwaduro nti pese obebo ho ban na watwitwi ne kama na wadi wo huni enti no ukope ne permanent white. Well, guess what? Omo ye na ayi veneer kra na ayese still obo eno so hu de eban enti no se o natural one why you say wo mo hu ban a na ukochi artificial one a eno so wo mo hu ban chire ni nyina be pro ama sikakasi a obo hu ban watue nyina na be den ebehi because wo kono uni hu ni se bidada now the artificial one so ba eno so uni hu ni and the other thing is o natural tooth no omo shave ade a enhaw ade a hwe enti ho chema no akono ma shave the artificial one atoto se the man ye o nails na enya ne kwa so no but like I said dentistry are very expensive. Some of these providers are money hungry because of the loans into cost one for diamond cruncher or so a bit drill was sinim at the diamond sisuma and so enya de bia and I think say promote to health. So it's no natural one. Nessa yellow nessa episode dear get teeth whitening or teeth whitening toothpaste a bebo. But so wo konya no Hollywood style near the all white asha swama. Now think say no. I know so eso obo ho ban. Enti wo de na nya media ma no. But no mo ban na mo wani nya den. And so So I wouldn't advise it.
Okay. Doctor made us see anyway. Or chance about Sunday metro with us.
Yo.
Okay. Dr. Mbachama, ebi amede betwa to because obiye ni ho no mu biem. Because me hu say adentina sa okoye feeling area aya na untimi asa wo sen film na untimi enye ade.
Oh, okay. So, so koya ade no se mpremu ho na o se film wa we hope is over time no. Sa se film no beko. But se film no feeling no se film no da ho wo so a eno answer ko dentist no ho na ka kire no say you still feel sensitivity or you feel pain. It could be some leaks be a what sa feeling no ho yes or eden or ko no fix eden ema nti no de say yes na ukọ a mani hu ana frɛ office ne say me be ya feeling still minya atinka bi ɛwɔ me se ne ho na mepɛ sɛ meba na mo bɛhwɛ ne yie sɛnea if you have to redo it ana bibisa na o mayɛ ɛde ayɛden abɔ o se ne ho ɛban ama.
Yeah, I'm asking that because say 6 months be a me court to say there woka no. My last one no mo ye feeling. Since then, mintime even fish cry mintime on this side. Mintime at this I say me moko. E ho ne ye me ya since o mo ye sade no. Yeah, into working me next one me kwa I will let them know.
Yes, always speak up and let them know say since o mo ye omo unya tinka bi wo ho omo hwɛ ma wo na really bothering you and also no yɛden koso kra from you doing your day-to-day activities ukasa terms na it will signal a sense of urgency no ma aboa wo when sense ba ko bi wo soro.
Yeah, Lily Chum pachomame ukasa free he.
Yo. Me Nancy Kakriam say Maxi say yes mercury feeling no can endanger our health. Yeah, if person ye feeling no, will it be advisable say you better dentist say is there anything apart from mercury? Na yenga bisha yesim no, how do we treat it? What do we do? That's it.
A very good question, Pa said. Some people are doing away with metal fillings now. Your friend amalgam. Now, on said because a drew insurance in the time or something before the meba metre and unsumu kakra based on your insurance. I used to take Medicaid, and the dentist that worked in my practice, Medicaid, also insurance Medicaid, I estimate. And instead of so obey the tooth color filling, which we call resin, and Medicaid will cover the metal one because aesthetically, people impede. Metal one, and obey amount. Instead of so obey tooth color filling resin, it's based on your insurance, will determine the type of filling. I will cut to say a metal. So, sa amalgam mercury amount focus a mercury woman. On said they heavy metal. And on said na a sister Judy Filka say or failing is or sa ye enya atinkabi. It could be said name filling a tooth color filling. So tooth color filling a very thin and yet as heavy as the metal a mercury no. It is only musua sa tooth color filling a resin. Sometimes unya tinka wo sinim because a close to the nerve and also and yet as heavy as the metal one mercury woman. Mercury and yet so much say a woman a bit me harming or body Also too much of everything na bad for your tissue. Kakrebi a woman normally they are forming with other compounds metals na ayede to me jina na ye dia shit to krunum sene be ya so always sasoa dia usually no sa mercury ni kura no omo de amalgam na wo kana mercury wo no omo ya omo ye no dodo mu sen so omo nye no sinanim so dodo mu ne sen The other thing is, say, be careful because encountered, could be 10, 15 years ago, Sibia no more yes, type of mercury, amalgam filling, no more, it take a good portion of tooth in the structure. It as mercury no, it take a good portion of your teeth, Say, funny say, omu eyi saa portion ni nyina free so a na wo saa ko yi free ho a kai hu say wo teeth are thin now, so you run the risk say omu ye no foforo no e be fracture. So omu yi old filling amalgam ni free so a na so omu the tooth color no e be hye ho a tooth color filling, which is the resin na you can run a risk say saa omu de back no resin no ana tooth color filling is shown resaso dia a bit me a fracture. Because the more I will shave with teeth, a cleaning metal everywhere shave, now will thin it with tooth structure. Into omode resin ko shemu sa tooth color filling omode be shem ebia as a film bebaso, because like I said, it's not as heavy as the metal. I think so no ebia o can say a bodom pema na always adioma will soon become brittle because it's thin. Now it means a fracture. Now they will tell you say to see in a free hole. It is a amalgam no and ya which is the mercury, say ya then cause no problems are. I will say let it stay, because for years and we use such practices. Say harmful be wa make us America and Canada UK we amalgam fillings. Ghana Tokyo baby omoye. So dental community ni who say ebia harmful they will stop it. But also we could see they say mercury harmful for the body it's not painful a patrebi wa ya catch us a memory because it's too much mercury in it a chronic forming at the early stage. Send but too much of it and kakrebi the form they added to other metals to hold, to sit inside the tooth to protect it and only enough to cause harm to the tissue. So obi also because the world say kakra wa ha na bebre wo mesimu a sene eno so a lot. Go to your medical doctor, they can do blood work and find out say too much a year, then they will take it out and put, because some people the immune is suppressed, and too much of everything and too many of it can cause problems. Obi wa kasi me yi mercury free me simu nyina no and my health get it better. Too much of it consult with your medical doctor, tell them and let them do blood work, and then you can go from there. I'm hoping say my answer or question nyina ama.
Thank you.
That's it.
Okay. Abusanfo yɛda yɛn nyinaa yɛ ho ase paa yie. Dr. Nyame Enshao. Pacho mema wo kwan na wa summarize aka wo final words ama yɛn.
Yo, Sister Judith, me that's it. Etiefo nso nyinaa me da mu nyinaa se ɛda ɔten ɛne mpanifo me da mu nyinaa se for kwanya mode ama me. Na mmerɛ nso ba mu a yɛbɛtumi asa atoa so with other things it could be obia ɛwɔ enipa ni bi ana yɛadwene mu a yɛpɛ sɛ yɛshare anaasɛ yɛsua free ɛho. So mekasa sɛ mmerɛ ba mu a yɛbɛtɔko about insurances ɛne mmabunu no ɔmo oral health, but the insurances no nso no ehia. Nso wohwɛ ayi so a yɛtwerɛ entrepreneur. I had the privilege to have my own independent dental hygiene clinic. I had 6 different dentists working there. I know about pulling insurances. I was contracted about many insurances: Medicaid, Delta Dental of Colorado, Cigna, Humana, Teza, you name it. I have a credential with them, so I know how the insurance work, right? Meda mpanifo nyinaa ne atiefo nyinaa se kakra me wa no kakra yesua ne dada ntino who questions biara na omutumi de me number ma yetumi eden go through it. I know all about insurances and other type of insurances too. Insurance is very important and train ema adeɛ ento ansana wakasa wokɔpɛ insurance kyerɛ kwan. Mmerebe mu ebekyerɛkyerɛ ni nyinaa mu. Medam ase nyame nhyira kakra yi so ma yɛn na ɔmmɔ yɛn ho ban na yɛnni nsɛm yi so sɛnea ɛbɛyɛ a yɛbɛtumi adi akyɛdeɛ a ɔde ama yɛn no yɛbɛtumi adi ɛho ni.
Pray anytime. Pray when you're sad. Pray when you're glad. Pray when you're weak. Pray when you're strong. Just pray and pray. 'Cause anytime is prayer time. Pray, pray, pray anytime. Pray when you're sad. Pray when you're glad. Pray when you're weak. Pray when you're strong. Just pray and pray. 'Cause anytime is prayer time. Ooh. The offices in heaven, they're opened up for you every second.